At home, rural hospitals across the country are facing staffing challenges, and now CHI Health is partnering with Creighton University School of Medicine to help fill that void. I spoke with the doctors who designed a new residency program that'll train physicians in rural areas. It's a first-of-its-kind residency program for future doctors. CHI Health and Creighton University School of Medicine are partnering together to give new doctors experience in both urban and rural areas of Nebraska.
We're actually expanding our residency training program so that the doctors that we train will now train in the rural areas with our CHI hospital partners.
Doctors Joanne Porter and Carrie Ward of CHI Health say there's a great need to train doctors in rural areas of Nebraska, as 34% of the state's population lives in rural communities.
There's much higher rates of death and disease in the rural counties, more poverty, more doctors retiring out there. So this is really important, and we're really excited to do this.
And according to the Rural Health Information Hub, people living in rural communities see higher rates of death from cancers, lung disease, strokes, trauma, and diabetes compared to urban areas.
And then psychiatry is such a need in so many communities. There's just so many problems that are unmet. And Good Samaritan and Richard Young, the psychiatry hospital there in Kearney, also are just great places to train psychiatrists.
Here's how the new residency program will work. Internal medicine and psychiatry residents will spend half of their residency training at CHI Bergen Mercy in Omaha. The other half will be spent at CHI Health Good Samaritan Hospital in Kearney.
And learning part of your practice of medicine in those communities gives you just a leg up, better diagnostic skills, better ability to diagnose conditions earlier. So it's a win-win.
Dr. Porter says most physicians end up in the city where they train.
We know that where residents end up in their training, whatever location that is, because they're starting their families, they've established community there, that's where they tend to stay.
So they're hoping this kind of residency program will entice doctors to stay in rural areas where they train, especially where they're needed to make a difference in the lives of people living there.
There's a lot of great doctors in our state that would love to practice, I think, in rural areas. That has a lot of rewards,
yes.
And this will help get them there and draw them there without a doubt.
The program is currently taking applications, and they say they've had immense interest in the program, and it's going to be very competitive. Match day will happen in March, and then internal medicine residents and psychiatry residents will start their new roles in July.